Good morning, everyone. Just waiting a little bit to make sure everybody was on. My name is Dave McCaleb with ATI Physical Therapy. Thanks to Cardenas for bringing us to the Connect Summit. We're going to talk about our PTFirst model and an employer path to musculoskeletal savings. A little background. This is a real life example. Steelworker Steve, in his mid 40s, works manual labor for a majority of his career. He enjoys youth sports, working in his yard and playing softball with his kids. His condition is low back pain. About 2 years ago, he started to feel some stiffness when getting up in the morning. And sometimes after playing softball, he didn't feel that great. Has been managing his pain with ibuprofen. And lately it's become more consistent and sometimes trouble sleeping. And then all of a sudden, 3 days ago, Steve's back goes out while helping a friend move some furniture. Sleeping is an issue for him, as well as coaching his son's soccer team. And yard work is out of the question for Steve, and work is becoming more challenging. This is a common occurrence that happens in all, especially physical labor industries. Employees, members don't necessarily know how to navigate the healthcare system. Here's what happens in a lot of scenarios. So Steve finally gets fed up with the pain and issues. He visits the emergency room where he goes to his PCP, starts racking up the high dollar bills. Then if he goes to his PCP or the ER, they might recommend that he goes to see an orthopedist and get an MRI to look at his back, and then an orthopedic follow-up. So that can lead Steve either potentially into more injections, surgeries, or possibly back to PT, right? But all in all, he's already spent almost $6,000 in the health plan. What we're doing at ATI really is trying to change that curve. I had a personal experience several years ago when I worked for a health insurance carrier where I had a neck pain that lasted for several weeks. I self-medicated with ibuprofen. Finally, I ended up calling my PCP, waited a couple of weeks to get in to see my PCP. And she recommended that I either see an orthopedist, possibly get an MRI, or go to physical therapy. And so really not knowing what I should do, I chose conservative care through physical therapy. Turned out it was a inflammation in my neck that was causing the problem. I went to 6 visits of physical therapy and the pain was gone. And I was given a routine that I could do at home to prevent that type of issue from reoccurring. But unfortunately in the system, most folks really don't know what to do with pain when they have it. Some of the groups we're working with by deploying a PTFirst strategy and really encouraging employees and members to seek out PT at the onset of a physical issue, not just acute, not just major problems, but weekend warrior injuries, minor issues that they're dealing with. Just by seeking out physical therapy first, we're finding at least 70% of the time we're able to correct the issue for those patients with conservative physical therapy care. In the event they need to go beyond that, certainly we triage back to PCPs and to orthopedists when necessary. But simply engaging in PT first and early before the issue becomes more chronic or more aggravated by non-use, we're finding the results are amazing. We're certainly seeing a reduction in opioid use as well. Physical therapists cannot prescribe opioids, and so that's not an early intervention piece where they can hit. And then as well, you see this is from a specific case study with a healthcare system that we partner with, where we delivered savings on their MSK conditions by over 26%. So where should I go, right? So for PT right now, there exists 2 models. One is in clinic on the left. That's where you go find a physical therapist through your network, through your carrier, or through your company. Really a new venture in physical therapy has occurred. The pandemic has certainly pushed all PT into virtual options. So virtual options have now been deployed. And sometimes that's a quicker way to at least get evaluated through a virtual PT session. and what's the right care, right? So, we have when someone at the onset of an injury, and again, not talking about an acute issue where they've had a major incident like a car accident or a major injury at work, we look at injuries at different levels, right? So low pain, no night or rest pain, just really more of a prevention issue. Someone can probably accomplish that via televisits over probably a 2 to 4 visit period. Televisit clinic would be maybe a combination with somebody has a more moderate level of pain. And these are, we produce these numbers through patient reported outcomes and a single assessment numeric evaluator code. Then it might be someone is doing a hybrid, right? Where they might want to go into a clinic for a few visits. And then if they're traveling or their schedule doesn't match up with them being able to see a PT, they're able to do their PT workouts from home. And then, of course, there's the high end, right? So with those folks, you might have people that have slip and fall risks or issues and would need to see a clinic pretty much all the time. From a patient experience mode, really you start precondition, patient event, and then intake, and then really 3 different methods, 3 different pieces are prescribed, right? So you have folks that are really okay and just might need a couple home exercises. So at that point, they might just be able to do the work at home. And if the condition or issue goes away, they're fine, right? And then the second mode would be deploying PTFirst, where you go through a 6-visit session and then see if you're feeling better or the condition's better, or you continue on for more visits. And then the last path would be referral, then to go potentially back to your PCP or an orthopedist. This is the way the video looks from a clinician perspective. So you would see the clinician, the patient would see a clinician throughout the entire visit. All the documentation is loaded into the patient's EMR and then is viewable by their doctor or orthopedist. We also record all the sessions. So the member is able to see the exercises they did and replay those exercises at home to make sure they're using the proper posture and movement that was prescribed by the physician. Appointment summary. This slide really is just the check-in, right? If someone has met either in clinic or virtual, we always do a progression summary. So we try to see how far the patient has come in their journey with physical therapy. With our ATI Connect process, we've seen about 60,000 patients through our system and have found 92% very satisfied. We also, I think what's interesting is we found the average age of our patient is 62. So from a technology perspective, I don't think we're certainly leaving anybody behind in this program. From an employer perspective, the biggest piece really is promotion. So how do we communicate a new strategy for defining musculoskeletal care and getting to PT first? Well, it really comes with communication. So through benefit fairs, health fairs, webinars, on-site screens, quarterly newsletters, mailers. There's ways to help promote employees and members going to PT at the onset of some kind of condition that's affecting their ability to work or live the way they want to. This is an example in a case study. Based on the current medical claims data, this is a sample. This is the kind of medical impact we can make. And what really the magic here for employers is reducing the barriers to accessing care. So number one, where do I go if I have an issue? And then what does it cost me, right? So for several groups that we work with, a $0 copay or a no entry copay is a great lead in to help people seek out conservative care versus higher cost care. We all know with HSAs today that complicates the issue. We have several clients that are using telehealth as an entry point for a lot of folks that have high deductible health plans. But even with a high deductible health plan, I think folks would rather try to get in for 2 to 6 visits of PT versus getting routed through the spend model that I showed you earlier, where they would actually hit their deductible. ATI in general, we have over 5,500 team members with 900 clinics across the country in 26 states. If you would like to know more information about how ATI can help you serve you or your employer, please let me know. And I appreciate the time today. I think there might be a question. Oh, no question. If there's any questions, please send me a chat link here over the next minute or so. If you would like to send me an email, my contact information is up here on the website, and I'd be happy to help you. Thank you for your time today. Okay, if there's no questions, I'll sign off. Thank you, Demetria.